Hello viewers, welcome to our program Development Zone, where we celebrate achievers, unveil the core potential of our nation, and also celebrate those who have contributed immensely to the growth of our country. During the program, we'll be talking health sector and we'll be chatting with Dr. Ogbe Jonas Omoruyi, the Medical Director of Cynosure Aesthetic Plastic Surgery. We'll be unveiling to us his view on the health sector and why the new administration need to take health sector much more serious so as to better the lives of all Nigerians out there. Sit back, relax, I'll be right back.
This is Cynosure Aesthetic Plastic Surgery. We are a specialized hospital which provides skills in plastic surgery. As you all know, plastic surgery involves a branch of healthcare sector which deals with the restoration of damaged parts of the human body, so as that the area is restored in both structure and function as much as possible. Being a healthcare center, primarily we deal with surgical cases which are mainly plastic surgery related. Okay, so plastic surgery has two broad groups or two broad divisions. The first is the reconstructive surgery, which involves the repairs of damaged part of the body. Like for instance, when someone has had an injury and there is an open wound that has to heal, we can do a skin graft, or you can cover the wound with some flesh moved from other parts of the body in such a way that the area is covered completely and the function of that part of the body is restored. Okay, so there is another branch of plastic surgery which deals with enhancing your beauty, which is commonly called the aesthetic surgery, although some people call it cosmetic surgery. However, we prefer to call it aesthetic surgery. Yes, so that deals with enhancing your body structure. Maybe there's a part of your body that requires an augmentation or a reduction, or things like that. Aging process of the face, you want to look younger in the face, or there's a part of your body that you're not quite confident about. So that involves restoration of that structure to as near normal as possible. Medical tourism is common to every country of the world, let me say that. It will amaze you to see that even in the first world, people still travel out of that place to other places to have their surgeries done. Okay, a lot of factors come into play. First, some countries have a long waiting list. You know, some conditions are more urgent than others. Some are more life-threatening than others. And on the other hand, you also find that the facilities available in such countries might not be able to provide all of the services needed by clients, or they can only provide it within certain time limit. And then for clients who feel they can't wait for the turn, or they don't think the expertise is available, even if it is available, so you see that brings about the aspect of perception. So in some countries, the perception of the citizens also have a great role to play in medical tourism. They just might feel, okay, I have to travel out to have the best done. Some also borders on confidentiality. Some might feel, oh wow, I just don't want anything about me leaking out to my local population. I just have to go out, even when they know that the facility in country can handle such conditions. So they just want to go very far away where people don't know them, and they're able to be more assured of their privacy. But by and large, all hospitals are supposed to be able to provide discreet services. I mean, not to divulge any patient's information to the public. It's part of the ethics of practice. There is a huge mix between all of the points you have raised. For instance, medical profession, as you know, is a career profession. Every practitioner wants to have his or her career enhanced. Now, I remember when we left school, a lot of my colleagues wanted to write their primaries, start their residency program, and all that. It will amaze you to know that even placement for housemanship for a fresh doctor is becoming very highly competitive. not because their services are not needed, but just that the spaces available in all of our teaching hospitals are much fewer than the number willing to come in. When there is a discomfort, someone will have to find a way to go around it. If you can't find a placement in an institution and you have to wait and wait, nobody wants to wait endlessly. You have to find an alternative where your career can progress. That is on one aspect. On the other aspect, the financial remuneration. You all know the situation of the country in terms of economic position of Nigeria. Everybody wants to have a means to an end. Everybody wants to have a means to be able to take care of themselves, their families, and even their extended families or their parents who sent them to school. Some on loan, some on borrowed money. So when they have left school and there's no way to achieve that, the pressure is going to be on them to travel outside of the country, especially when they have friends who have left the country before them and are similarly doing well and able to send money back home. So there's nobody who doesn't love to be able to take care of the financial needs or bills of the family. So that puts a lot of pressure on Nigerian doctors, especially as it seems to be getting easier for foreign countries to just come into Nigeria, set up recruitment centers in different parts of the country, and begin to recruit doctors. So you can see that apart from the pull, the push is there from the individual, and the pull is also there. So when these two factors meet, it's just going to get worse for the country to have practitioners who probably never thought of leaving this country to now leave more easily, because the practitioners get to meet with foreign recruiters who lodge in various hotels and just tell you, just apply. You just might be lucky. And then by the time they apply, even this for fun, they are called, come for the interview. They tell you when you come, you have accommodation waiting for you. You have a program to be able to start your residency, or you have so many good things that come with that everybody desires in life. So it's hard to have young men or women who, especially who are single, don't want to travel out of this country to make their lives better. They're lacking medical personnel in all sectors, in all subspecialties of Nigeria. First of all, for the population of this country, which is about 200 million, let's be conservative on 200 million, the number of doctors you have is so few. So by the time you work out, the population to doctors ratio is huge, it's alarming, and it's even getting worse. And then the population of Nigeria keeps growing. Our growth rate is really very high. With the growth rate rising and the number of doctors leaving, the situation is only going to get worse. And with the insecurity in various parts of the country, I can tell you, I know colleagues who have been displaced from one part of the country to other parts, because of insecurity, So when they have to leave their comfort zone, then you definitely will have to think out of the box to just find a way out of the country. My candid advice for the new administration would be that I would expect the Minister for Health and other stakeholders to call for a stakeholders meeting. I think there should be an all-inclusive meeting wherein issues relating to brain drain and brain gain will be discussed. Issues relating to increasing the capacity of all our teaching hospitals to absorb doctors from the youngest, talking about house officers, to registrars who want to specialize in various areas, and also consultants, be discussed, such that everybody has a say in how they think things can be done better. No one person can have all of the ideas, I must say. But the truth is, once we are open, I'm sure there are many Nigerian doctors abroad who still want to come back home to contribute their quota to the development of this country. So for the new administration, once people abroad see the sincerity in wanting to make things better, in wanting to secure the country, in wanting to improve the infrastructure, the light, the road network, and all the things, it's definitely going to be a natural incentive for people living abroad to want to come home. Some are retiring, they want to retire to a distant country. Some are still in the country and don't want to leave, but there shouldn't be a lot of pressure on them to leave. Once all of these things are put in place, the remuneration is better. We don't necessarily have to match the first world in terms of the pay. It's really not possible. However, when the pay is decent enough, most people are not asking for too much. You just want to be able to take care of their wives and children, take care of their bills, live in a decent home, have good water. Be sure when you go out on the road, you're not worried about kidnapping, you're not worried about people assaulting you, and things like that. So these are things that will naturally make people want to think out of the box, to travel out of the country. Challenges relating to a medical entrepreneur in this country is huge. You need to be more than motivated to be able to stay back and work. Not forgetting that the healthcare sector is not an area where you invest in and you begin to get your recoup your investment within a short time. It doesn't work like that. You have to grow your clientele base. So in doing that, you need a lot of finances. Because by the time you start a facility, you should expect that you should be able to pay salaries out of the investments in the healthcare business. Don't expect that you will begin to make profit or break even within the first 1-2 years, depending on the area you're practicing. So loan availability is important. I can tell you, starting off, we had a lot of challenges getting loans from banks. Even the banks, which are bankers, will tell you, "Oh wow, your turnover is so small, we can't give you any loan. Sorry." We'll go to another bank, the same thing. We'll go to the third one, the same thing. So it was really very discouraging. But the will to survive, the will to thrive, the will to succeed were more than enough for us to persist. Sometimes we had to take loans from family and friends, beg vendors vendors to supply things on credit and let us pay on installments. So these were some of the things we had to go through. So apart from the finances, the other issue, which is very important, is the issue of power supply. The last place you want to have outages is in the hospital, because some equipments are very electricity sensitive, and some you have patients who need to be on machines for a very long time, especially in areas where you have intensive care unit. So the ventilators, for instance, can't afford to go out of power, and many others like that, or during surgical operations. So you need all the power you can get, and to have alternative sources of power like solar power, inverters, or generators. You can tell how much it will cost you to keep a 100 kVA, for instance, generator running for 24 hours. You know how much that will mean. So these are some of the things. Not only that, then the personnel costs, the human capital. Talking about doctors, many doctors in Nigeria now are so disenfranchised that when you give them a job, be sure that within a short time they are leaving. So you put a hospital in a huge cycle of having to train and retrain new set of doctors. As you're training and they're getting experience and you're getting more comfortable with them, they're looking out there to travel out of the country. So even if you try to incentivize, they're working with the facility, you give them a lot of incentives, do your best to make sure they have good pay and all that, good training, good living conditions. You have to struggle. You can't match what is available out there. So that's a huge factor. God, in the next 5 years, we hope to have become more of a household name in Nigeria, with everybody, with at least one person knowing those whose life has been touched positively by Cynosure aesthetic plastic surgery. So we hope to continue to give our best to this country, to, as much as possible, make Nigerians know that some of the things you go abroad to get is already here in the country. It's so much, I don't even know where to start from. We've done so many things, and then we have so many clients who are happy with the results, and we tend to improve on the successes we've had. Our organization will prioritize safety. You know, now you get to see that in Nigeria, the number of patients with hypertension, diabetes is quite alarming, and a whole lot of people who are overweight also. The number is rising. So we had to think out of the box to look at ways of doing this surgery as safely as possible. And one of the things we have come to see is that when you're able to do many of these surgeries in an awake state without general anesthesia, I mean, you're likely to have reduced the risks of general anesthesia completely. Now, for us, we can say that to the glory of God, we are able to do basically all of our surgeries, including tummy tuck, breast reduction, and so many other things with the patient fully awake. That means that the general anesthesia risk is totally removed, and that's a good thing for us, and we're happy about that. That's one of the ways we're able to work on patients who are plus sized, who are unable to get their weight reduced. So when you're working on someone and the person is talking to you and telling you how he or she feels, I mean, that's a good thing. That's one thing that distinguishes us from most other centers. Apart from that, we are also happy that we're able to deliver on the results that we give. Our results can match any results from anywhere in the world. Yes, especially in aesthetic surgery. We can do as good as anywhere else you think about in the world. I'm Dr. Ogbe Omoruyi. I'm from Edo State. I schooled in Uniben, and then I joined the Nigerian Army. I actually retired as a chief consultant plastic surgeon in the Nigerian Army, and then Cynosure aesthetic surgery has over the years improved steadily. As you already know, the word of mouth keeps spreading. When people are happy with you, they tell their friends, and that has kept us going, and we thank God for that. When you're in private practice and then you begin to get busier, you need to really work extra hard to balance all of these, because every time your clients want to reach you, you need to keep monitoring your patients on admission. You need to balance everything. So there's really no time to switch off your phone. If I were an entrepreneur in business, like selling of any merchandise, I could actually switch off my phone and sleep. But we can't do that. In the middle of the night, my phone should be open 24 hours, because the doctors on call could call you and say, this patient needs this attention and that. So it's hard. So even when you are having your recreation, your phone should be open. That's how tough it could be. So it's the price we have to pay, but I think we're loving it. It's what matters. I think it's important for Nigerians to take their health very seriously. I think Nigerians should patronize Nigerian doctors. You know why? There's a whole lot of practitioners out there who are not doctors, but you see them online, you see them on social media, spewing out things that are unverifiable, telling you they can cure this with one simple thing. It's quite sad that everybody has access to all of this information that are incorrect. And when you hear that, because it's so charming, it's so easy to believe. They tell you, take this and your diabetes is cured, or your hypertension is gone forever. I wonder how that is possible. So if it were possible, I'm sure all of us would have been doing it. But there's nothing like that. But they don't know. They want to try everything, and by the time they're coming back to the hospital, it's too late. We see that a lot amongst cancer patients. You see someone who has breast cancer, stage 0 or stage 1, let's say stage 1, which you can treat, and the patient will have a normal life thereafter. You see them running around. I'm telling you, people I know You beg them, please, let's do this now. And they run away. They switch off, they even block your phone so that you don't disturb them. And by the time you hear from them, from their relatives, it's just too late. We see that every day. That's just one aspect. You see that in other areas of healthcare, and then it's the same thing. Is it optometry? Is it in all areas? Gynecology. You see women still deliver at home in this 21st century. You see women still do some unwholesome things, you know. So other thing is smoking. Smoking habit is just rampant now, especially among young girls. I mean, until recently, I never believed that Nigerian girls indulge in a lot of smoking. I thought it was only men who smoked, but right now it looks like more women smoke than guys right now. So that's a huge problem. It's a huge problem. And then weight control, you know, checking, going for checkups, as I think once in a year, you know, ensuring you maintain a good lifestyle, your eating habit, you know, the smoking, your drinking. You know, you should cut down if you can't stop totally. Well, we already know that alcohol doesn't do anything good in the human body. So all of these things are lifestyle modifications that would definitely help to improve the longevity of the lifespan, life expectancy of every Nigerian. And when you do fall sick, go to a reputable place. Don't just go to a pharmacy to buy your drug. You don't know what you are treating. You might have symptoms similar to what you think you had previously, but it might be totally a different thing. So see a doctor, get investigated, get treated appropriately, and if he advises you to see a professional in another area, please do follow the instructions, you know, and things will be better. For Nigerians living abroad, I want to speak first to the professionals abroad. We want to encourage them to come home. For those who feel that strong urge to come home, you know, some of us had the privilege of going abroad for training. We had to resist all of the temptation to stay back abroad. You know, however, people are different. People have different reasons to want to stay abroad and do whatever it is that pleases them. But then I want to encourage them to come. There are new areas to be explored. For us, we are exploring the area of plastic surgery. For some others, it might just be other subspecialty, and think of ways of improving things. You know, and if the government can continue to improve on national health insurance scheme to be able to capture more and more Nigerians into the scheme, that will definitely help the health of an average Nigerian.
Welcome back. Like you heard from our guest today, he took our time to outline the importance of our health and also told us how effective and how reliable their outfit is when it comes to plastic surgery. I will urge everyone of you out there, take out time to visit them to see the great wonders our God is doing through them. Till I come away again, I remain your host, Joseph Uzuakondobolijo. Bye for now.